25 years female complaining of on and off pain in lower abdomen, and this is the simple cyst of right ovary which has undergone the hemorrhagic changes. Inside this hyperechoic, what you see is the hemorrhage part. The hemorrhage which is present in the ovary, it looks a little bit hazy, this type of, due to the clot, and this is also a kind of septa which we see in the hemorrhage. These are the fibrin strand which look like septa. Here is the liquefied part of the blood collection. This is not endometriotic cyst, because a typical endometriotic cyst will have a homogeneous ground glass appearance inside this cyst. But here the hyperechoic area is present over here, and here there is an echoic. So this is the liquefied, or it may be the simple fluid also present in the ovary, and this could be the blood clot. But the presence of simple fluid in this part is more likely. There are internal septations. You see this hazy pattern. This is typical of the hemorrhage, internal blood collection. उल्टे हो जाओ, एकदम उल्टे हो जाओ पहले,
एकदम उल्टे,
एकदम, बस, अब सीधे हो जाओ. We had turned the patient to be in prone position, and see now this whole, once again the patient is in supine position after being prone position, and here this all debris which are present in the cystic area, ovarian cyst, it is moving. Once again we will tell her to give the prone position and to move back again in supine position, and we will see the this thick fluid moving inside the cyst. फिर से ऐसे उल्टे हो जाओ, फिर से. ओके, तुरंत सीधे सीधे, तुरंत सीधे हो जाओ. You see this fluid is moving, it is a blood collection. It is right ovarian simple cyst which has undergone hemorrhagic changes, internal hemorrhage inside the cyst. Might be due to venous stasis, and there is a cyst torsion also over here. Yes, you can see this septa which is protruding from the inner wall. This is typical of the cyst torsion, and when the cyst get torsion, it goes into hemorrhagic changes. This hemorrhagic change is not like the hemorrhagic cyst which we see during the menses. It is a different kind of hemorrhagic changes due to the stasis of the venous blood, more likely. This internal septa, this is typical of torsion. We have to look at the another site also, if there are such. Yes, there is one more here. here is the attachment of that cyst. No, sorry, this is the uterus. This is uterus. And the cyst wall has become a little bit thick, the two-layered cyst wall. This is also sometime present in the hemorrhagic cyst. There is a wall edema, and that's why the cyst, you will see these two parallel hyperechoic line, and here also the wall is quite thick. Normal simple ovarian cyst wall thickness is maximum up to 1 or 1.5 mm, but here you can see this the wall thickness is 5 mm, so this is quite diagnostic of torsion. Here also let us measure the parallel line. It is 2.8 roughly, more than 1.5, which is normal. And this is the area where the torsion has occurred. You see this septa